You go to the statement.
Yes.
Then, now, we still have that. I'm still speaking and still dividing. We now debunk the myths that the pharmacist give.
So, in summary, I will handle from here. Eric has introduced it. And then
Not by reading. So you have everything. You want to read everything?
No, it is good. No, let us read. That will guide us. Because I'm interact now for a very short time.
But the time to debunk, the myths, specific myths, and let's brief.
And there is the same myth with
but this one has a wider range.
Maana nini? Kama hiyo, you can give them today, need a copy.
All of them will give. This one is what you don't read.
I need summarize.
This one is what we use for the bank. Later on, there's a free airtime.
Sorry, I'm trying to pass. Sorry?
We are not live on social media.
Yeah?
We are live on social media.
Oh,
Honorable members, ladies and gentlemen present in this brief today, I want to take this opportunity to thank the media houses, the National Executive Council, and the members of the Kenya Pharmaceutical Association. Kenya Pharmaceutical Association is a professional body that brings together over 12,700 pharmaceutical technologies. These are spread across all the 47 counties within the Republic of Kenya. And the mission of these pharmaceutical technologies is to uphold the highest attainable standards of practice of pharmaceutical care in this republic. We are here today as the Kenya Pharmaceutical Association to address the matter of the Kenya Drugs Authority Bill 2022. We are all aware, everyone who has been going through and has been listening to the TV and to the radios, that Kenya Drugs Authority Bill is being discussed in the Parliament, and that is why we are here today, so that we can be able to give to be able to try and enlighten the public about what the KDA bill is in brief. Firstly, we would like to thank the National Assembly Departmental Committee on Health for the great work and report they have done on the KDA Bill 2022. The National Assembly Departmental Committee on Health undertook a robust process of engaging key stakeholders in the formulation of the bill, which therefore resulted in the current set of recommendations that take care of the general public, that is you and I. In representation, Kenya Pharmaceutical Association, we affirm that the committee's thorough consideration has yielded a report that is conducive to the greater public good. This is particularly significant for the widespread accessibility of pharmaceutical commodities and services, which is a very critical need for the citizens across all the 47 counties of the Republic of Kenya. While KDA bill, that is Kenya Drugs Authority Bill, is currently at the second reading in the National Assembly, our attention has been drawn to misinformation and lies, which is being propagated to the public by pharmacists under their umbrella, the Pharmaceutical Society of Kenya. And some of the lies which they have peddled publicly, one of them is that a pharmaceutical technologist is a technician. Another lie which they have peddled publicly is that pharmaceutical technologists have been responsible for the deaths of the patients in the Republic of Kenya. In other words, they have said, and they have gone publicly to say, that pharmaceutical technologists are killing patients by giving improper medication. Another lie which they have gone publicly to say is that pharmaceutical technologists cannot and are not capable to handle drugs in wholesale. I want to welcome my colleague who will take us through the KDA bill in brief, just to try and enlighten the public that a pharmaceutical technologist is indeed capable of handling the healthcare, is indeed capable of giving the right medication to the general public, and whatever our colleagues have talked about is not true. Thank you. Karibu.
This is Jane Kili, and we would like to state, as a representative of the Kenya Pharmaceutical Association, North Rift Branch, that we want to debunk on the lies that are spread by the PSK, and we are stating as follows, that there are only two cadres recognized by Cap 244 laws of Kenya, Part 2 and Section 6, under the registration, and that is the pharmacists. Those are the degree holders in pharmacy. The second one is the pharmaceutical technologists, which are represented here today, and these are the diploma holders in the pharmaceutical technology. So we are here to state that there is no such cadre as pharmacy technicians in Kenya. Kenya does not train pharmacy technicians. It trains pharmaceutical technologists who are able to handle drugs, who are able to handle the poisons, and they are well trained and enrolled by the Pharmacy and Poisons Board. So the second one is the fact that we are claiming to be equal with the pharmacists. We are not equal to the pharmacists at all. What we are just asking about this bill is that let the law recognize us as pharmaceutical technologists, because our services are very much important, even to the remotest part of this country. So we have, at the moment, we have over 12,000 pharmaceutical technologists in the entire, and they are capable of handling drugs. They are capable of handling patients. There is no such word at any point that these pharmaceutical technologists can mishandle the patients. So they run and own over 80% of community pharmacies and chemists in Kenya. So they provide the much needed farm care, such as handling of scheduled substances. So they enhance the last mile access to health, as envisaged under the universal health coverage. The pharmaceutical technologists are not the hindrance to achieving maturity level 3 certification by the World Health Organization. We want to state categorically that maturity level 3 is the mark of a stable, well-functioning, and integrated regulatory system. It's not about cadres and the practice of pharmacy. So pharmaceutical technologies has no hindrance in ML3. Another thing is about the wholesaling. We are requesting that the wholesale be opened by both cadres. On assessment of the risk in practice, there is higher risk in the dispensing where the pharmacist is, the pharmaceutical technology is, the dispensing in the hospital or in the community pharmacy. Then there is higher risk there where a pharmaceutical technologies can handle comfortably as compared to the wholesaling, whereby it's just the movement of commodities from point A to point B. So we don't see any risk there, and a pharmaceutical technologies can actually handle that. So we support the Health Committee report without further recommendations, because in that view, our practice will be anchored, and it will be able, the country will be able to achieve its universal health coverage because of the services provided by the pharmaceutical technologies. I take this opportunity to welcome our Deputy President to talk about the bill. Thank you.
Thank you, everyone. My name is William Sonchumba, the Deputy President, Kenya Pharmaceutical Association. So I think basically KDA is the game changer in this field. KDA will make sure that access by the remotest person in this Kenya gets quality healthcare. One of our brothers said that quality access can only be offered by degree holders. That is a false kind of information to the public, because level 1, who manages? Level 2, who manages? Level 3, who manages? We have around 4,600 pharmacists against 12,760 pharmaceutical technologists. A pharmaceutical technologist is the person within your neighborhood who gives you medicine every single day. There is a misinformation that went through Parliament during the second reading, which we noticed that someone may have misled the parliamentarians to agree that there is a cadre in Kenya called pharmacy technicians. There is no cadre in Kenya called pharmacy technicians. This can be found, you can check within the records of the regulator, that is the Pharmacy and Poisons Board, if they have any cadre called pharmacy technicians, which is not available, it's not there. So what are we saying? KDA goes as it is from the Parliamentary Health Committee. We were given time to give written memorandum. We were given time to give oral memorandum and oral submissions. And all of us, pharmacists, pharmaceutical technologists, gave our input. Where it came to change that we want to be equal, we are not sure. Where it came to change that we are now fighting for veterinary products, we are not sure. So the center line is, let our MPs pass this thing as it is from the Health Committee. That is one. Number two, Kenya depends on pharmaceutical technologists. As much as we may say they are giving substandard, they are being trained by reputable institutions, that is KMTC and other TVET institutions. What does this mean? If we discredit pharmaceutical technologists, if we say that they cannot give or they cannot dispense a prescription which has been done by a fellow diploma holder, that is a clinician, a clinical officer, or a nurse who can administer the same, what are we telling the Kenyans? The 4,700 people or pharmacists cannot handle the entire healthcare in Kenya. That's a fact. They cannot handle. We have been in the field from 70s. That's a fact. We have the expertise in training. That's a fact. We are regulated by the Pharmacy and Poisons Board. It is a fact. We are in the law, up 244, stated clearly. That's a fact. So we are equally important in achieving the UHC that the president just launched the other day. We are equally important in achieving UHC. So no one should brandish a claim that they are the only ones who can serve in the market. No one should brandish pharmaceutical technologists as untrained or improper trained, or they got supervised internship. They still sit for 2 levels of examinations for them to be accredited and awarded a certificate to practice in Kenya. They still undergo 1 year post-internship. So they are properly trained. That is what we can pass. Number 1. Number 2, we can say without, we are really risking the lives of Wanjiku. If you close these guys out, we are risking the lives of Wanjiku, number 1. Number 2, if we close these guys out, we say that they are not able to dispense psychotropics, and they have been dispensing ever since 70s. What are we saying? It means your sick kin who is suffering from maybe epilepsy and needs the simplest medicine to control epilepsy will have to queue maybe or travel several kilometers to achieve or to get his prescription filled, because it means the 56 million Kenyans will have to look for around 4,600 people to give them the simplest psychotropic medicine. Assuming that all of us were sick, what would that mean? It means we will not be able to access the medicine. If we are not able to access the medicine, it is the end of that patient. So let us not jeopardize the lives of Kenyans by peddling lies and giving information that is not proper to the community. One, and we are urging the MPs in the parliament to support the bill as proposed by the health committee without any amendments. Thank you.
And those who came in a little bit later, we can do a summary.
So in summary, we can